We all know the importance of sleep and how crucial it is for recovery and health. But show me one doctor whose sleep cycle and circadian rhythm isn't messed up due to erratic call schedules or emergency duties. We all know the importance of having a healthy, balanced diet. But show me one doctor who gets to eat a complete meal at the designated time it is supposed to be had. I'm not speaking about a salad, and coffee definitely does not count. Don't even get me started on the fact that we have McDonald's and Starbucks right on campus at a few hospitals. We all know and preach about the importance of reducing stress and how it can negatively impact one's health in so many different ways. But it is a recorded fact that all those working in the healthcare sector have the worst stress levels amongst most professionals. Let's look at the stats. Between 300 and 400 physicians each year commit suicide. Year after year, the National Institute for Occupational Safety and Health compiles a list of jobs with the highest suicide rates. Want to take a guess at which job tops the list? It's medical doctors and dentists. An estimated 11% of all medical students seriously consider suicide every single year. 1 out of every 2 physicians experiences job burnout. The burnout rate for physicians is highest in almost every occupation. It's almost double the burnout rate for attorneys. So what happened to practice before you preach, huh? Many of y'all might not know my story, but the reason why I wanted to become a doctor because when I was a very little kid, I would go to visit my grandma in the hospital. She suffered multiple fractures due to weak bones, had many comorbidities, suffered a lot of illnesses, and spent a lot of time at the hospital. And every time I asked her,
Granny, when will you be alright?
because I missed her. She was my partner in crime in many ways. More on that later. But every time I asked her when would she become completely alright, she would look me straight in the eye and tell that the day I became a doctor and treated her, she would be fine. And the little kid in me actually believed her. But I guess that is what ignited that seed in me to become a doctor. My grandmama passed away years before I could even get into medical school. But the thought of being able to heal someone, being able to help someone feel better, and being able to help people lead healthy lives again is what drove me into this profession, and I believe it drives everyone who gets into the medical field. Honestly, I never dreamt of doing anything else apart from pursuing medicine. But after spending more than a decade in the medical field, seeing the actual behind the scenes in the medical world and at both ends of the spectrum as a doctor as well as the patient, I realized that in this pursuit of helping everyone lead healthy lives and become well again, nobody really bothers whether doctors are being able to stay healthy themselves. Think about it. You spend the prime years of your life, your golden years, studying endlessly, taking competitive exams, staying up all night during different rotations, learning about the intricacies of the human body and how we can help it heal, spending hours doing research and trying to come up with novel therapies or trying to find out the root causes of various illnesses, hoping to make a change and so that we can help our patients in a better way. Now I can speak for hours on the kind of injustice, if I might call that, for a young brilliant mind to go through only so that he can bear MD or DO or an equivalent medical professional degree to their name and to be able to start making a difference. Maybe that kind of rigorous training is required, I don't know, maybe. But sometimes it just makes me wonder if doctors and nurses, residents and interns, nurses and nurse practitioners are all overworked and have such hectic schedules, why aren't we hiring or having more people to divide and space out the work? When there is such groundbreaking research taking place, why do doctors and researchers have such a hard time getting it published in a reputable journal? Now, I might not completely understand the politics behind open access and many other things that are plaguing our medical system today, but I really feel researchers, doctors, medical students, and all those who contribute to the scientific community should not have such a hard time getting their work published, lest I say have to pay for it. In fact, I think it should be the other way around. Just like journalists get paid for their research and providing articles to the press, maybe on a similar basis, doctors and researchers should be compensated for their time and the efforts that have gone behind conducting research and contributing their work to the scientific community. Let's also address the mindset of those in the medical field. Like when I graduated and had the first opportunity to adorn my white coat, I had this magical feeling of being a superhero. I thought I knew it all and that I could save all lives and make the entire world healthy. But I realized we're still limited and especially fell flat on my face when I lost someone very near to me. That incident and helping patients day in and day out, along with learning about the alternative forms of medicine, made me realize that there is so much more to human healing. And I came to accept the fact that what is meant to happen will happen. I realize we are only these little guides who are helping execute the divine plan that He has already created. But I know not all in the medical field might resonate with my thoughts. Most generally don't during the initial few years of their career, but they might when they experience the same fate as I did. Either have a life-altering experience yourself or with someone that you love very dearly, and then you may start questioning. Today, I also want to dedicate a moment to all the women in the field and to the men too, of course, but especially those who have kids, have families, and are still working full time. I cannot even enumerate the number of sacrifices that people have had to make only so that they can continue with their work and be able to help others. Missing the birth of your newborn, missing her first step, his first word, not being able to attend your little one's soccer game, not being able to have dinner with your loved ones, couples staying away from each other, kids not being able to give enough time to take care of their parents, parents bearing the guilt of not having enough quality time with their little ones. These may all sound like simple things, but they add up. Trust me. It is said that female physicians are 1.5 times more likely to be divorced or stay unmarried than male physicians of similar age. I never even thought of these things when I considered being a doctor. But today I see my friends, my colleagues going through different situations in their life, and sometimes it makes me question, is it all worth it? My heart tears every time I hear of a medical student committing suicide. I am filled with rage every time I hear of a healthcare worker being diagnosed with diseases like cancer or succumbing to heart attacks at a very young age. I feel numb when I hear of relationships ending or families being broken only because they needed more time together. I'm not saying this is true with all, but in my quest to help people heal, get healthy, and get better, I feel doctors deserve to lead a healthy and happy life as well. And when I say doctors, I mean everyone working in the medical field and all working professionals in general. We all choose to do the work we do because we love doing it. We are passionate about it because that's what makes us who we are. But in this pursuit, I don't want us to sacrifice or lose something that is dear to us. If you are a doctor, a nurse practitioner, or a healthcare provider watching this video today, I want you to take a moment and tell yourself that it is to think about yourself, your health, your families, and your priorities because you are human too. I know we entered this field because we wanted to make a difference. We kind of knew what we were signing up for. We want to be able to help. We want to be able to save lives, and surely you can. But if you're going to get sick yourself, who is going to take care of those who need your expertise? All I'm asking you to do today is take a step back and try to prioritize what is important to you and for you and your family. If you're in an authoritative position, try to implement changes that equip your department towards overall health. And even if you aren't in a position to make radical changes in policies or administration, we can always do it at our own level. I know as doctors, what we mostly discuss is about our patients' well-being, about the new research or what else can be done. But try to take a moment and ask, how are you feeling today? Do you need help with anything? You get it, right? Sometimes you can just look at the opposite person and know that something isn't just right. Try to support your colleagues during those times of need. It always starts with one little step in the right direction. And if there are any medical students watching this, I don't want you to get discouraged at all. You are choosing a field that is magnanimous and rewarding in so many different ways. I still remember the enthusiasm and pride that I felt on the first day of medical school. A sense of humility when the first patient assigned under me was discharged from the hospital. And when I received words of gratitude from families and patients till this very day, all because of the amount of help that I could offer and the difference that I could make in their lives. That enthusiasm and fire to help is still burning right here. But I have seen and experienced a lot to tell you that there will be hard times and sacrifices that you might have to make which you might not have been prepared for. At that time, it will all come down to what do you choose to prioritize. Either way, I never want anyone to feel guilty about the choices that they make. But I don't even want a doctor or any human being to end up as a statistical number. I know I opened a lot of topics for discussion today, but these were just a few things that were eating me up since a very long time. I started this channel not only to share what I know, but also to help raise awareness and create good changes. And I'm hoping this will make a positive change. I'm also aware that I might be slightly more biased towards the medical community simply because I belong to it, but I feel that they are truly deserving. So to all my colleagues in the healthcare profession, thank you. Thank you for all you do. But please remember to take care of yourself. We all need you. If we have healthier and happier doctors and healthcare professionals, that means we will have more angels to help people during their times of sickness and need. And we will see a domino effect in the entire healthcare sector and perhaps in the entire world. I'm Dr. Sanoba Pesa Doctor, and I always root for health for all. Let me know what your thoughts are, and let us try to be the change that we wish to see. Continue to glow, thrive, and shine as always. Take care. I'll see you soon.
But keep your head up, Charlie. We were made for this life, yeah. Wait to see how we rise up. We've been down for too long, waiting for a come up. Better days around the corner. All the pain made us stronger, yeah. We aim for the long run. Keep on surviving in this war for no reason. Now we changing the season.